Hi, this is Dr. Sata. I wanted to give a little bit of an update on what we've been doing at CIH as far as long COVID treatment options and a new protocol called the Post-Viral Recovery Program that I've been using with a number of patients, which seems to be pretty helpful. This was a protocol that was developed originally by Ovation Labs, which is a group that's been putting together some of the research and trying to apply that in an integrative medicine approach or a functional medicine approach. And they've developed a program for long COVID, which I think is really promising. And so here's some of those results. First, back in April of 2023, I recorded a longer video that goes over some of the science behind long COVID and what we think we understand, or what are some of the theories about the potential mechanisms associated with long COVID, and what are the potential treatment strategies that may be amenable to address those causes. And so the link for those is below, and I think that can give you some additional background. When we look at this program I got involved with a little after I had done that video, and so it's very similar, although not exactly the same approaches. Essentially, it's another research-driven protocol, but it's been more boiled down to an actual specific protocol, and it's looking at 5 different drivers that seem to be associated with long COVID. So one of those is the ACE2 damage that we see. And ACE2 receptors are the receptors that the virus uses to get into the cell to start to replicate. And you have ACE2 receptors in all sorts of areas in the body and all kinds of tissue. And it seems that once those have been damaged, then people can have ongoing tissue damage that lasts quite some time. And that involves some of the endothelial cells, which are the lining cells of the blood vessels. So that's one of the components that contributes to long COVID. There's a concern that there's persistent virus in some patients where they just can't fully clear the virus, and that's part of what's driving their ongoing symptoms. And then we see problems with ongoing chronic inflammation. This is essentially like the body had an inflammatory response, which was initially appropriate during the infection, but it just can't figure out how to turn that off. Think of it as a car alarm that you just can't turn off again. And so that seems to be one of the contributing factors. We know there's some disruption in the gut microbiome, or the bacteria that are in the gut, and that seems to be persistent even after the acute viral episode is over. And then we think there's some issues with mitochondrial dysfunction. And the mitochondria are essentially the powerhouses of the cells. And if that's not working well, then people have limited energy, and that can contribute a lot to the fatigue that patients are feeling and some of the post-exertional malaise, and potentially to some of the brain fog that a lot of patients feel. And so this protocol has basically been developed with the idea of trying to address all of these factors at the same time in a more integrative approach to see if that holistic approach can help provide better outcomes. And so far, it seems to be working. We can see there's a trial called, or a questionnaire called the Promise 29 questionnaire, and it's essentially a symptom questionnaire that's been validated in a lot of studies. And we're checking that Promise questionnaire at the beginning and then again at 90 days into the trial. And essentially, patients are getting better at every check. And so there are a number of questions that target the physical function of the patient, social participation, fatigue, anxiety, depression, sleep disturbance, and pain. And you're seeing an improvement in physical function and social participation, and then a decrease in fatigue, anxiety, depression, sleep problems, and pain across the board in the patients that they've analyzed so far. And so far, there are about 40 patients that have gotten all the way through the 90-day program. There's well over 100 enrolled, but they're at various stages in the process. And we're seeing a pretty broad improvement across all these categories. We also look at something called the post-COVID function scale. And this is a scale just looking to say, what's the actual impact on the patient of their symptoms? And if you go from 0, which is effectively no physical limitations, no symptoms, nothing, down to a 4, when you're at a 4, you've got pretty severe functional limitations. Those are patients who are having trouble even getting out of bed. They're not able to work. They potentially need nursing care at home. And there's a scale, from 0 to 4 that leads up to that. This is a pretty large changes in someone's physical life and what they're able to do between each point on the scale. And in this 90-day protocol, what they found is that the baseline score is a 2.0. And so that's some limitations where people are potentially still able to go to work, able to take care of what they need to at home, but sometimes they have to cancel on things and they may need to decrease some of the intensity of what they're doing. That's sort of the average initial score. Now, certainly we have some patients that are much more severely impacted than that and some that are much less impacted. But to jump from a 2 to a 1.2 just in 3 months, I think is fairly impressive. And that's even more impressive when you consider how long some of these patients have had long COVID, because I believe approximately 80% of the patients enrolled have had symptoms for at least a year, and a large percentage of that have had symptoms for actually 2 years. And to see this much of an improvement in 3 months, I'm pretty encouraged by. We look at some of the early patient responses and their reviews of the program. These are not my patients. They're some of the patients from other providers enrolling in this trial, and they've gotten pretty good results. People are showing an improvement in their migraines, some of the chest pain and shortness of breath that's been bothering them, their mental clarity, fatigue, energy, muscle fatigue, all sorts of different symptoms seem to be getting better. And so with that in mind, I wanted to go over some of the details of what this protocol encompasses. And it has a number of different supplements, and I'll go over each one of these. But these are kind of 6 specialty supplements that are really focusing on the main drivers of COVID, or of long COVID. And so if we look at the first one, Tolavid, this is an antiviral. It's isolated from Gromwell root, which has been used in a lot of Asian medical traditions, Chinese and Ayurvedic medicine, and it's an antiviral and appears to have some impact on the virus being able to create the spike protein and enter the cell. And it's a protease inhibitor, which is similar to some of the prescription protease inhibitors, but we've chosen this one because it's supposed to have a much better tolerance, much less side effects than some of the prescription protease inhibitors that are being investigated as well in other trials. And the theory behind this type of intervention is effectively that viruses can get into the cell, and these are RNA viruses, so that's their genetic code, and they use that RNA to create a polypeptide chain, which is basically like a very long string of amino acids. And once you have this super long strand of pearls, you use a protease, which is this little Pac-Man thing that can cut these string of pearls up into individual sections. And then each one of these sections can fold up on itself and form an actual functional protein. If this can't be cut apart, then this string of pearls can't fold up into any sorts of proteins, and the virus really can't do anything. This strand is not going to be a problem, but when you cut it apart and then it folds up into a protein, for example, this viral spike protein, which is what allows the virus to get into cells, if you can prevent that, then you should be able to inhibit ongoing viral replication. And the concept of a protease inhibitor is it's kind of like this little orange piece that goes in and blocks the Pac-Man. And so the Pac-Man can't disrupt or can't chop these proteins up into functional units. So that's the antiviral side of the protocol. Then we look at something called arterosil. And arterosil is looking at the endothelial inflammation that we know is involved with long COVID. And one of the things we see is this is an example of some of the damage that COVID can cause by damaging the ACE2 receptors. And I had said there are ACE2 receptors in a lot of the cells in all sorts of tissues in the body, which is part of what contributes to the vast array of symptoms that patients can have. Whoops. But one of the tissues that gets damaged are the blood vessels, and that's the endothelial cells. So this is the ACE2 mediated damage. And if you look at this picture up here, this is a cross section of a capillary blood vessel. So one of the teeny tiny blood vessels in the body. And this is a zoomed in version of that. And you can see right here, you have the endothelial cells. And so those are the cells that are really the inner lining of the blood vessels in your body, including the capillary vessels. And there's a protective coat that defends these endothelial cells, and it's called the glycocalyx. It's this fuzzy carpet layer here. And I think about this kind of like a jello layer or Teflon coating that's protecting the endothelial cells. And it's very susceptible to stress. So I believe in this example, they're showing how rapidly you can erode that away with higher and higher blood sugar. And that's part of the theory behind how diabetes and high blood sugar can damage all of the micro blood vessels in the body. But blood sugar can do this, high blood pressure can do this, and excessive oxidative stress can do that. And when we look at COVID patients, one of the ways that COVID can cause damage is that it overwhelms the body's antioxidant capacity. You basically exhaust all of your glutathione, which is your antioxidant system, and then you start having more damage, more oxidative damage that can disrupt this glycocalyx. And now you have unprotected endothelial cells, and you can have more of this microvascular damage. So Artericell is particularly targeted at addressing that. Then we look at mitochore. This is focusing on the mitochondrial dysfunction that we're seeing. And mitochondria are these little organelles that are within the cells of all the cells in your body. So that includes the heart cells, the neurons, the muscle cells in your body, and also the skin cells. But you can imagine the skin cells are nowhere near as metabolically active as, say, your heart muscle. And so you don't need nearly as many mitochondria in your skin as you do in your heart or in your brain. But all of the cells in the body still do have mitochondria to some degree or another, and they're all running on effectively the same biology. And so one of the things that COVID does is it can damage this endothelial layer, or this wall of the cell membrane layer. And it can do that by uncontrolled oxidative stress, which I had mentioned beforehand was a problem. If you start to damage the mitochondria, then the enzymes, which are in the mitochondria, which are embedded within these membranes, can no longer function like they're supposed to. The oxidative stress can also damage the enzymes themselves, but once you've knocked out the mitochondria, then you're going to have a lot more problems with patients who are describing fatigue or post-exertional malaise. For example, they feel fine when they wake up, but then if they do too much, or they have an upsetting phone call, or they tried to work for a long time and they're just too tired to continue. And when I think about that, I think of that kind of like you're spending energy that you don't have. And so this is a little bit of a geeky biochemistry diagram, but think about this as the biochemistry behind creating ATP, which is the cell's energy production. And in general, you need to be able to digest fats and carbohydrates and proteins. And then you need to get those nutrients across the cell membrane into the cell. And then there are a whole bunch of enzymes within this cycle called the citric acid cycle or the Krebs cycle. And all those enzymes need to be functioning well for this cycle to work and for you to generate ATP. And the function of mitochore is effectively to provide some of the nutrient cofactors you need to allow this biochemical cycle within the body to work as optimally as possible. And so that's the story behind mitochondrial support. Then there are also two supplements that are targeted at supporting the gut microbiome, because that's another aspect of people's health that gets disrupted. And the first is a spore-based probiotic. And I think the advantage of using spore-based probiotics is that they're in a dormant state. And that means that they're more able to survive the acid bath in your stomach and to get to where they need to get to downstream in your GI tract. And it's not that we really think these supplements are going to completely repopulate the bacteria that are in your gut, but they effectively set the stage to allow the normal healthy bacteria to recolonize. So we start with pore-based probiotics for a little while, and then we switch over to prebiotics, which is effectively fiber, and that provides the fuel or the nutrients that the good bacteria need in order to thrive. And so the combination of these two is both targeted at addressing gut microbiome disruptions. It's not specifically addressing pathogens if there were any there, but if we're just trying to rebalance what got out of balance with COVID, then I think this can be really helpful. Then we also look at something called ITIS or ITIS. This is a combination herbal product that has a lot of different herbs that are associated with either anti-inflammatory effects or antimicrobial effects. And I think this can help shut down some of the excessive cytokine storm that won't turn off in association with COVID. It also provides some additional antimicrobial support so that you have more ways of trying to address the issue. And if we look at each one of these supplements, so here's the Tolavid. These are the two for the gut microbiome, the ITIS, which is the anti-inflammatory, antimicrobial, Arterisol, which is supporting the endothelial cells in the vascular system, and then Mitocore, which is mitochondrial support. You can see the doses that we're using. Tolavid starts at pretty high doses. You're at 12 capsules a day initially, and then you bump it down to 8 and then down to 2. And one of the reasons I think Tolavid is effective is that I've seen patients who are on Tolavid, they feel much better when they're on it. And they're typically patients who haven't felt well for over a year by the time they're starting on all this stuff. And so they're starting to feel better. And then in some patients, not all, when they start to step down on the dosing, they notice that their symptoms start to get worse. And if they go back up on the Tolavid, they feel better again. So to me, that's pretty convincing evidence that the Tolavid really is having a fairly meaningful impact for those patients. I know I've seen that with my patients, and a lot of the other providers in the trial have noticed that as well. One of the things we're investigating is how do you successfully maintain those gains that people are feeling when they're on the Tolavid. And there are some ideas about how we can potentially do that. But I do think that this is a really impactful part of this program. I think the Mitocore, looking at mitochondrial support, is also really important. And then the Arterisol, looking at some of the microvascular damage and trying to help heal some of that, is particularly important. All of these components are kind of necessary for putting together the number of pieces that tend to have fallen apart during this kind of comprehensive disease process. But if I had to put, the number 1, 2, and 3 supplements on here, I would say it's Tolavid. Number 2 would be Arterisol, and number 3 would be Mitocore. Then we also look at a number of foundational supplements, and I think of these as basically just good health. So I think having decent vitamin D levels and checking your vitamin D is useful. Being on some fish oil. Quercetin is anti-inflammatory. The fish oil is anti-inflammatory. CoQ10 and magnesium are both very supportive of the mitochondria. And so I think these are kind of foundational. And then there were the 2 in the gray that I think of are kind of dependent on the individual. Vascanox I'll talk about first, and that's effectively looking at whether or not you have the nitric oxide function that you need in order to dilate blood vessels appropriately, and to make sure that you're getting the appropriate blood flow where you need it. If the blood vessels can't dilate because they don't have enough nitric oxide, and so they're artificially constricted, that's just a going to compound some of the problems that you see in association with endothelial inflammation. So this is something that we consider in some patients. And then 5-HTP is something that's kind of emerging as a potential treatment option. And I'll show you a slide. Essentially, 5-HTP is right here. So tryptophan is an amino acid, and we know that the absorption of tryptophan in your gut is frequently impaired in patients who have long COVID and COVID in general. And so if you don't have enough tryptophan in your system, that's the precursor for serotonin and melatonin. And serotonin is very important for mood regulation, for depression and anxiety. And a lot of antidepressants and anxiolytic medications specifically target the serotonin receptor. And we certainly see a lot of long COVID patients who are having mood dysregulation. And I think some of that is related to this pathway. We also know a lot of people have insomnia, and I think that can be related to a disruption in melatonin. And so there is certainly a good argument to say adding 5-HTP, which is effectively an intermediate step between tryptophan and serotonin, can help support this system. So that's something we consider in some patients. We know that in the setting of inflammation, all of the cytokines that are active in inflammation can then go on to activate this enzyme called the IDO enzyme. And that further diverts tryptophan down this alternative inflammatory pathway that then just depletes all your precursors for serotonin and melatonin. So depending on someone's symptoms, I think it is potentially reasonable to add 5-HTP to their protocol. The other aspects of this, we have some really basic labs that are associated with the protocol as it was designed by Ovation Labs. Frequently, we end up ordering a little bit more in the form of laboratory evaluation, depending on somebody's history. But I think looking at some basic CBC, CMP, on some inflammatory markers, vitamin D and thyroid panels make good sense. Then we also look at an anti-inflammatory diet, and they've designed the protocol to use a Whole30 diet. I think that's primarily because there's so many resources out and available in general on how to implement this diet. And I think that's really helpful. When I try to approach this with patients who are extremely symptomatic from their long COVID, some of them are just not in the physical condition. They don't have the energy for a complete and total dietary overhaul. And so there are a lot of tricks to get around this. Some of that can be meal delivery. Some of it is just improving your diet and moving it in this anti-inflammatory direction, even if it's not perfect. And then as people start to feel better, then you can have more energy to try to put towards, a more compliance with this diet. But I don't think it's an all or nothing thing. One of my patients who's actually done really well on the protocol, when she first started, there was no way this was really in the cards at all. And after she'd been on the supplements for about a month, she felt so much better that she came back and said, you know what, now I'm ready. I think we can do all of this. And she had a lot of energy to try to put towards this. But this is another aspect to the protocol. Then we look at lifestyle support. So that's making sure you're getting enough sleep, looking at pacing, which is just to avoid excessive activities and things that are going to exhaust you. And what used to exhaust you before long COVID is going to be very different than when you're trying to recover from long COVID. And this can certainly be challenging for a lot of patients, especially when they have a good day, because you finally have a good day and you feel like, okay, now I want to catch up on all that stuff I haven't been doing. And a lot of people push it a little bit harder than they can tolerate, and then they end up crashing the next day. So figuring out how to find that balance for you, I think, is important. Some patients are using continuous, like a heart rate monitor, to check to see how their body is reacting to the activity they're doing. If your heart rate gets up to 130 when you're just up washing the dishes, then maybe you do need to sit and take a break, even though it seems like that shouldn't have been that much energy or exertion for you. Clearly, your body is reacting as though it is. So that's an aspect. Then we look at different techniques to support stress reduction, because certainly ongoing stress can continue to drive the inflammatory cascade. We look at aspects of social support to try to help with patients. And we are in the middle of trying to put together a long COVID group that hopefully will launch in January of 2024. And so we'll have some more information coming out about that as well. And then trying to incorporate some level of movement so people just have that activity. I think that's good for your mental health and your physical health, but we have to figure out how to adapt that so that it's not leading people to crash afterwards if they try to push themselves too hard. Then there are some additional testing options that we can consider. The Evoke test is a quantitative test of cognition on brain function, and that's looking at executive function and attention, signs of neuroinflammation, and mood changes. It looks at processing speed. I've included a link here for a whole separate video that discusses this. The vital scans is a test that we do that looks at autonomic nervous system balance, basically the balance of your fight or flight system and the rest and digest system. And a lot of patients who've been struggling with long COVID for an extended period of time are basically pushed over into the fight or flight state continually. And we're trying to figure out how to rebalance that for them. And then in some patients, depending on their symptoms, we could consider specific gut microbiome testing with the stool testing. I would typically recommend working with a nutritionist because there's so much overlap between what you eat and your diet and the results of this test. And then we also do some mitochondrial testing that I think can provide a little bit more precise recommendations, but I don't think you necessarily need that. Mitochondria are impacted in so many patients that I think you can just treat the patients empirically and then maybe do some testing in the future to try to tailor things a little bit more depending on the results. But that's up to each patient. So those are the things that we've been doing so far. And it looks like so far we're getting pretty reasonable results. People are improving. I have a couple people who are going back to work after having been out of work for an extended period of time. A lot of patients report brain fog is a little bit better, chest pain is a little bit better. It's not a miracle, and it's not like, things get better 100% immediately, but certainly this is a process that seems to be helpful. So if you have any additional questions, you can reach out to us at CIH. If you'd like to schedule an appointment to discuss this, feel free to do that as well. And that's it for now. Thanks so much. Bye.